Hi guys and girls, today we're going to be looking at specific phobias and I'm going to be honest, it is going to be long. Alright, so essentially everyone experiences stress and it is considered a normal part of life, which you all know. So stress is a state of physiological and psychological arousal produced by an internal or external stressor that are perceived by the individual as challenging or exceeding their ability or resources to cope. Essentially, you need to make sure that you have both physiological and psychological. So it affects you from a mental point of view, but also a physical one. With anxiety, it's a little different from stress, and you need to know the difference between the three of these. Anxiety is a state of physiological arousal, so it's just the body, and it's associated with feelings of apprehension, worry, or uneasiness that something is wrong or something unpleasant is about to happen. So, for example, you're afraid of, how you might do at the end of year 12, right? And you start having that, chest palpitations and things like that. So that's what anxiety is. It's a physical state. Although we can experience anxiety in certain situations, it should certainly be brief and temporary. Right? So once you've overcome it, once it's come along, it disappears. If anxiety is severe or exaggerated and does not subside, it can be counterproductive and disabling to the point where you start having, shortness of breath, sweating, trembling, nausea, all those sort of things, and it turns into something else. So an anxiety disorder is when it becomes too overwhelming. That anxiety becomes too overwhelming. And it's used to describe a group of mental disorders that are characterized by chronic feelings of anxiety, distress, nervousness, and apprehension, or fear about the future with a negative effect. And you just can't overcome it. You keep thinking about it, and even though you know it's probably not going to happen, you keep thinking about it. It's sort of like saying or when your teacher says, "Oh, I'd like to speak to you after class," and you spend the entire time having that anxiety about it, and it just doesn't go away. So you need to know the difference also between a phobia and a fear. So a phobia is characterized by an excessive or unreasonable fear, and you need to make sure that you use those words, excessive or unreasonable, of a particular object or situation. Fear is rational. If it happens to be a swarm of bees chasing after you, you should be afraid. Right? That's rational. But a fear of balloons is irrational, and it's usually excessive. So when you're comparing the two, you would say that fear is something that's rational, but a phobia is out of proportion to what the actual danger is. There's also a compelling desire to avoid the object, and it causes significant distress and interferes with daily functioning. Remember, I keep telling you, that is the important part to remember. So in other words, what you need to know, you must be able to tell the difference between stress, anxiety, fear, and phobia. So stress is a state of physical and psychological arousal produced by an internal or external stressor which interferes with daily functioning. Anxiety is a state of physiological arousal associated with feelings of apprehension, worry, or uneasiness that something is wrong or something unpleasant is about to happen. A phobia is excessive or unreasonable of fear of a particular object or situation, which leads to avoidance behavior. And fear is rational response. You should be fearing a dog chasing after you. Alright, so this is how we like to look at continuums. So mental health was on a continuum. So this is the first one here. But stress, anxiety, phobia also are on continuums. So let's say, for example, you have a fear of spiders. It might be that, you actually like spiders, so you're up here, that's crazy, but still. You come to here and you start to go, "Oh, I don't like spiders, I kill them automatically." Or this one here is where you start going, I can't be in the same room as a spider, and you scream running out of the room. I used to make kids walk through the room if there was a spider on the door. It jumps on them first. Alrighty, this is a very good comparison of the difference between stress, anxiety, and phobia. Please go through it yourself. You may want to pause it here and just read it yourself. So a specific phobia, if they ask you, hint, hint, nudge, nudge, if they ask you about a phobia of trees or a phobia of, of dark places or a phobia of something, then it is a specific phobia. Right? So make sure you're very clear about this. It is a specific phobia. And then you go into a specific phobia of animals, a specific phobia of situations, a specific phobia of. Make sure that when you get asked that question, the first words that you should write are, it is a specific phobia of. So, it is a disorder characterized by marked fear or anxiety about a specific object or situation, often leading to avoidance behavior. So, fear is a rational response. Anxiety is that fear of what could happen. So, I don't want to go underneath my house because I have an anxiety about the spiders that live there. And there are spiders. I've seen them. I'm sure they're there. And then they're going to jump in my hair and lay eggs and I'm going to die. Anyway, that's irrational. I may have a phobia. So generally the phobias fall within one of the following 5 categories. Animals, so spiders, snakes, etc. Situational, aeroplanes, elevators, enclosed spaces, tunnels. Natural environments, so heights, storms, darkness, etc. Blood injection injury, seeing blood, having blood taken, having an injection. The funniest thing, and I know I shouldn't say this, but the funniest thing I've ever seen at school is when kids are getting their, their vaccinations and whatever, and they have some kids that believe that the needle's going to go straight through their arm and they're going to die and all their bones are going to drop off. Oh, I've seen so many kids with this fear, and this is why stigma is a problem, because people like me laugh. I shouldn't. I'm so bad. Anyway, so other phobias include choking, vomiting, loud noises, costume characters, blah, blah, blah. And you can see why with these phobias you might actually have this sensation of, oh, I don't want to do that in case this happens, or in case, right, I don't want to eat chicken in case I get salmonella. But not all chicken will give you salmonella if you cook it right. So, when someone has a specific phobia, exposure to a phobic stimulus typically triggers an acute stress response involving physiological changes like those of the flight, fight, freeze response. So you have a similar sort of reaction. Right? And this reaction could be so intense that it forms a panic attack. And it's a period of sudden onset of intense fear or terror, often associated with feelings of impending doom. And this is where that anxiety comes in. You start feeling that, no matter what you do or say, nothing's going to change. And it just becomes so overwhelming that you get worked up and you start having a pounding heart, sweating, trembling, right? You start feeling really dizzy because you're not getting enough air in. And some people will actually fear that response, right? So an attack may be expected. So let's say, for example, you're going to a birthday party, but you're afraid of balloons, right? So you're expecting to go off. Or it could be unexpected, and there's no obvious clue, it just happens. So anticipatory anxiety is the gradual rise in anxiety level a person thinks about or anticipates being exposed to a phobic stimulus in the future. And there are some people who are starting to get very phobic about going out into society these days, going out and possibly getting contaminated with the COVID and things like that. So it's very crazy, right? And they get so nervous and anxious that they don't go out, which is probably a good thing because you're supposed to be locked down. So for those with the phobia, the anxiety may rise to a level where they're incapacitated by it and they won't do anything. So the different types of phobic disorders, social phobia, where, it's really difficult to perform in front of others or speaking in front of anybody. Agoraphobia, unreasonable fear of a situation, and it's usually a huge space, or a specific phobia. In VCAR, we tend to look more specifically at specific phobias. Remember what I said before. It is a specific phobia of. So, factors contribute to the development of a specific phobia. Always relate it back to the biopsychosocial model. It has what the factors are, which we go through very quickly today. Well, it's not quick, but put this into your notes. And so the factors that influence it are the psychological, biological, and social, and the best treatment should be biological, psychological, and social. Please remember, it is holistic. It is not just one factor which leads to a phobia. It's all three. And it's not just one factor that will cure it. It is a combination. So the 4P factors, all you need to be really worried about is how it actually comes on and how it continues on, and just put this in your notes. It's very important. So you need to know the biological factors which bring it on, the psychological factors that continue it, and then the social factors. Alright, so the biological, we're going back to GABA, just like it was in stress. So, several neurotransmitters have been identified as playing a role in the experience of anxiety, and one of these is GABA. So, gamma-aminobutyric acid is a primary inhibitory neurotransmitter in the central nervous system. So, it makes postsynaptic neurons less likely to be activated, less likely to fire. Right? And this is where anxiety can come on. So, GABA also plays a role in anxiety because it acts like a calming agent, or a brake to the excitatory neurotransmitters that lead to anxiety. So there is evidence that some people experience the anxiety associated with phobias because the neurotransmission of GABA becomes dysfunctional. So GABA's there to actually stop those anxious feelings coming through. That's not exactly what it does, but essentially you need GABA to calm the nervous system down. So stop the physical side of stress and anxiety. So GABA dysfunction can therefore result in low levels of GABA. People with specific phobias and other anxiety disorders are more likely to have lower GABA level. Make sure you remember that. People with specific phobias have low levels of GABA and hence GABA dysfunction. Very, very important. Alright, so the biological contributing factors could be the stress response. So anxiety involves feelings of apprehension, worry, or uneasiness that something is wrong or something unpleasant is about to happen. This is considered to be the psychological component of the response to a phobic stimuli. Underlying and interacting with this component is a physiological component that is like the physiological response to a stressor. So because there is a perceived threat or impending harm at the sight or thought of a phobic stimulus, the flight, fight, freeze response is activated. And what that's pretty much saying is because you have this fear, let's say of spiders, right? And I'm about to go underneath my house to have a look at what's there. Because I have this anxiety associated with spiders, just the thought of going underneath my house and being confronted by spiders is enough to trigger the flight, fight, freeze response. And I assure you, it is going to be flight. I am not going underneath my house. I send other people. I'll pay someone. So, the heart rate and strength of the heart rate increase, the blood flow, all that sort of stuff associated with the flight, fight, freeze. Right? You tend to have these reactions and it gets associated with phobic anxiety. And these can lead to palpitations resulting from a pounding of heart, sweating due to increased perspiration, and when breathing becomes faster and deeper than necessary, this can result in hyperventilation, which can heighten the anxiety being experienced and also induce a panic attack. So you start having this panic that you're going to experience these symptoms, right? And these symptoms are so uncomfortable that you start now not only panicking about the spider, but you also now start to panic about panicking. And so you panic, and it becomes problematic. Okay, so when you're looking at a phobia, it becomes especially problematic and difficult to cope with when it's not actually there in front of you, right? So if your stress response actually is triggered by no real threat or danger, so let's say, for example, I happen to be afraid of a spider that's in a picture. There's no threat to me, but it becomes non-adaptive because I might not look through textbooks because I might see that picture. So anxiety is therefore problematic for someone with a specific phobia, as their level of anxiety tends to be inflated or excessive because of their perception of the threat is unreasonable and out of proportion to what it should be. This means that the physiological stress response they experience is often very severe and can persist at this high level for at least as long as the exposure or anticipated exposure to the phobic stimulus. So your stress response might actually last longer than what it actually is when you're exposed to that phobic stimuli. And this causes long-term potentiation. So long-term potentiation can therefore neurologically strengthen the association between the phobic stimulus and a fear or anxiety through its activity at the synapse. So the more the connection is activated through each encounter with a phobic stimulus, the more the connection is strengthened. So let's say, for example, every single time I do have a fear of spiders, it was at one point a phobia, right? And it started because when I was little, I was bitten by a spider, and then again, I was in my bed when I was about 4 or 5, and a nest of whitetail spiders happened to have hatched underneath my bed, and they bit me, and I had to go to hospital, so that's twice. And then in year 7, I was at the tennis court, and a nest of spiders flew out of the tennis net, and it attacked me, and I freaked out. And then there have been numerous times where I've been bitten. Spiders are out to get me, okay? Right, so because I keep having those repeated associations with that anxious response, with the fear, with pain, right, there's long-term potentiation. And that's where you're sort of getting to classical conditioning as well. But we'll get into that in a minute. So the more the connection is activated, the more the neural connections are actually strengthened, and it increases the efficiency in transferring fear information. So before it may have taken, you know, a severe response, a severe attack of the spiders in order to actually elicit a response, now it's just looking at an image. And that's because over time that connection has associated the pain with the spiders, and that's led to fear. So it increases the efficiency in transferring fear information along the pathway and decreases the likelihood that what has been learned will be forgotten. I'm never going to forget being bitten and rushed to the hospital. Spiders. Alright, so behavioural models for the psychological factors. So according to behavioural models, phobias are learned through experience and may be acquired and maintained or modified by environmental consequences such as rewards and punishments. So a specific phobia may be precipitated through classical conditioning and perpetuated by operant conditioning. So essentially when they're saying precipitated, they're pretty much saying that it contributes to, and then perpetuated means to maintain. So please try to remember that. Precipitate means it can bring it on, so it causes to a certain extent, and perpetuate means to maintain. So it's brought on by classical conditioning and maintained by operant conditioning. So this is a two-part process called two-factor learning theory. So this is what it is. So consider 23-year-old Sam who has a specific phobia of spiders. He initially developed his fear at the age of 4 when he saw a photo of a big hairy spider in a book and his father used it to scare him. He subsequently became quite scared and anxious whenever exposed to a spider in books and other media. One day, Sam unexpectedly came across a live spider while playing in the sand pit in his backyard. It moved so quickly in his direction and gave him such a fright that he jumped up and ran away in terror. Since then, Sam has never intentionally gone near any sandpit and will not even go to the beach for fear that there may be a spider in the sand. He also avoids any situation which there may be a spider, even if the spider is likely to be harmless, fake or dead. For example, Sam will never read a book that may have pictures of a spider in it, nor will he watch any television program or movie if he believes that there is a chance whatsoever of a spider appearing. In effect, Sam developed a conditioned response, fear, to a conditioned stimulus, the spider, that had been associated with fear-inducing unpleasant stimulus, the UCS, and then generalized to similar stimuli, any spider. Many people feel scared or anxious around spiders, but Sam's fear is disproportional to any actual risk, and his fear has imposed unwarranted restrictions on his life. So when you look at this, what you should be focusing on is, and I'll see if I can highlight it, is this section. Right? You're developing a conditioned response, which is the fear, to a conditioned stimulus, the spider, that had been associated, with fear-inducing unpleasant stimulus, so the UCS, and then generalized to similar stimuli of any spider. You need to be focused on that. So when they say, how does classical conditioning contribute to a fear, or how is a phobia precipitated by classical conditioning, this is what you need to be including. The bit that is highlighted is what you really need to focus on, and just change it to the different stimuli. That's the best advice I can give. So perpetuation means to maintain. So it's kept in your mind and your thoughts through operant conditioning. So after acquisition through classical conditioning, the phobia can be maintained, and we need to highlight that, and therefore perpetuated through operant conditioning. So operant conditioning keeps that fear in your mind. So in the previous example, Sam begins to avoid the fear and anxiety producing phobic stimulus, so spiders, and avoidance reduces or removes the unpleasant feelings of fear and anxiety, so avoidance is negatively reinforced. So we might just put that in there too. Right? So avoidance is negatively reinforced. We're removing something unpleasant. We're removing the spider. So it's the same sort of thing. If you happen to come across a spider and you get your parents to kill it instead of killing it yourself, what you're actually doing is negatively reinforcing that fear, right? And that's bad. So in the future, any response that reduces or removes fear or anxiety will also be negatively reinforced. Consequently, any avoidance response to any phobic stimulus will continue to be reinforced through operant conditioning. So if you're trying to get over something, you should face it head on rather than trying to avoid it, because avoiding it is negatively reinforcing the behavior, and that's bad. So I would recommend putting this into your notes. So this is precipitating, so this is contributing to fear and classical conditioning, and this is operant conditioning, so you are reinforcing that behavior. Put it into your notes. So cognitive models focus on how the individual processes information about the phobic stimulus and related events. According to these models, people can actually create their own problems and symptoms by the way they interpret objects or situations. So essentially, how you actually see it and how you think about that particular phobia can actually make it worse. So you tend to have a cognitive bias about your phobias. Right? And that's a tendency to think in a way that involves errors of judgment and faulty decision making. With spiders, there's always that belief that they're going to crawl in your ears and lay eggs. That doesn't happen, but people have that fear that it does because it's a cognitive bias. You want to think the worst. It may have happened once, but it's not actually going to happen. So cognitive bias involves mistaken thinking, which is why it's sometimes referred to as cognitive distortion. The biased or distorted mode of thinking may be due to limitations in the cognitive abilities of the individual involved. So people who are more gullible, people who have a lower intelligence are more likely to believe such things, right? There could be an underlying motivational factors. So for example, a fear of something else has led to avoiding the spiders, which means that it gets worse and worse and worse, or because information has been interpreted according to one's personal likes, dislikes and experiences in order to adapt to a specific situation. So I don't particularly like certain things like going underneath the house and things like that. I'm contributing that to also spiders, so we're lumping it all together, right? And I'm just going to blame spiders. So cognitive biases can be habitual ways of thinking, so you constantly think about it, and make someone more prone or vulnerable to experiencing fear or anxiety in response to a phobic stimulus. Two of these cognitive biases include memory bias and catastrophic thinking. So memory bias refers to the distorting influences of present knowledge, beliefs and feelings on the recollection of previous experiences. So let's say, for example, my fear of spiders comes down to, all those times when I was a kid when spiders have bitten me, or their nests have hatched in front of me and gone all over me, and I couldn't get spiders off for so many hours. Anyway, because I'm constantly thinking about it, right? And every time I do this PowerPoint, I keep thinking about it too. But I'm only basing it on that particular memory, right? I'm not basing my fear on all the other times that I've seen a spider and it hasn't attacked me. I'm only basing it on what I've experienced in the past and only dwelling on that memory. So a consistency bias is memories of past events that are distorted through the reconstruction to fit in with what is presently known or believed. So it's all like the reconstruction of memories. Because you don't remember everything precisely, because your heart rate is up, because you're in that fear state, there is a good chance that you're not going to remember everything. So you reconstruct it, right? And you tend to remember the worst parts of it. And so it's distorted. And this is the consistency bias. The change bias is whenever we recall a past experience, we exaggerate the difference between what we knew or felt and what we currently know or feel, which can lead to phobic fears to grow over time disproportionately from what they are in reality. So, yes, I was bitten twice. Don't know how this keeps happening. But because I was bitten, I had to go to the hospital. It was really bad, right? Red back and then a white tails. And it was literally, I keep thinking that it was the worst pain ever. But I don't even think I remember the pain. But because I have this fear of spiders, you automatically assume, yes, it must have hurt a lot and, burnt and, oh, it was the worst thing ever. So I keep dwelling on that pain and that intense, and it keeps changing because I'm exaggerating what it actually felt like. It probably didn't feel like anything. It's probably too doped up on drugs afterwards. Who knows? Alrighty. So, like I said before, memory recall of a phobic stimulus or experience to focus on or to be better for negative or threatening information than for positive or neutral information. Like we said before, with the spiders, I'm more likely to remember the negative experiences I have with spiders rather than the positive ones. And the same sort of thing with phobias of horses. You maybe only remember the time that you were chased by a horse and not all the other times that horses are cute and cuddly. So another one is catastrophic thinking. You think the worst of the worst every single time. So catastrophic thinking, we all do it, is a thinking style which involves overestimating, exaggerating or magnifying an object or situation and predicting the worst possible outcome. So you assume that every single time that a spider comes near you, it's going to bite you. You assume that every single time you come across a dog, if you're afraid of dogs, it's going to chase you and bite you. Every time you leave your house, you might, die. I don't know, I'm going with it. And that's that thought. It's the worst of the worst. So, social factors. So we've gone through the biological, we've gone through the social. The psychological. Social is different things that happen in your environment. So specific environmental triggers, so developing a specific phobia after direct negative experience with an object or situation. I was afraid to actually sleep in my own bed after the spiders hatched from underneath. I was so afraid. Anyway, so that was an environmental trigger. Tennis court. I haven't actually stepped on a tennis court since that happened. So maybe I'm afraid of tennis courts now. Anyway, so stigma around seeking treatment is another issue, and this is a contributing factor. It also prevents you from seeking help as well. So because you're embarrassed or shamed about the fact that, you know, you're afraid of balloons or clowns or spiders, right? And you're afraid that other people might actually laugh at you, right? You're less likely to seek help, right? And you're less likely to inform other people about it. So, many people were diagnosed with a specific phobia report having a direct negative or traumatic experience with a particularly phobic stimulus. I can attest to that. And some people in the past, and sometime in the past, and can attribute this encounter to as the cause of their phobia. So something in their environment has triggered their phobia. So we're talking about stigma, and we looked at this a little bit with stress. So the nature of a specific phobia and its symptoms mean that individuals with a phobia are particularly vulnerable to experiencing stigma. Because you're going to have people out there who are going to laugh their asses off because you happen to be telling people that you're afraid of cotton balls. That exists, people. And that they're afraid of flowers, or they're afraid of balloons. There was someone who was afraid of clouds. Imagine having to go outside and being afraid of clouds. But they're so afraid about what people will think of them, they have this stigma associated with it, that they don't seek treatment. They don't tell their friends and family. They try to keep it to themselves, which only makes things worse. Despite the terrifying fear of objects and situations, telling someone may result in ridicule, belittling comments, and not being taken seriously, and sometimes discrimination through differential treatment. Oh, we can't invite her to the birthday party because we may have a clown, and that may scare her, and that'll ruin my day. Alright, some of the evidence of actual treatments. So evidence-based interventions, and just before we move on, evidence-based interventions are interventions that have proven to work. They are ones used by psychologists. They are ones that there are research about it that actually say these are effective. Right? And they are valid and reliable research studies. Alright, so these include the use of benzodiazepines, breathing retraining and exercise, psychological interventions such as cognitive behavioral therapy or CBT, and systematic desensitization. There's also the social intervention of psychoeducation for families and others who may be close or to provide social support for some with a specific phobia. So, biological interventions. They essentially are trying to overcome the biological mechanisms that trigger or contribute to the phobia. And usually benzodiazepines are pretty good, and they usually use this medication to target GABA dysfunction, because remember, low levels of GABA equals high levels of anxiety, and it can minimize the onset or severity of the symptoms. But usually they're used in combination with other things. Remember, biopsychosocial, always holistic. So benzodiazepines are a group of drugs or agents that work on the central nervous system, acting selectively on GABA receptors in the brain to increase GABA's inhibitory effects and make postsynaptic neurons resistant to excitation. So it's actually making sure that the nervous system gets calmed down. So it mimics, and that's the word they want to use, it mimics GABA receptors. So, generally drugs and other medications work by stimulating a neurotransmitter's activity called agonists or inhibiting a neurotransmitter's activity called antagonists. Benzodiazepines are GABA agonists. So they're there to actually increase the amount of GABA. So what they're actually saying is benzodiazepines will have an inhibitory effect on postsynaptic neurons throughout the brain and reduce the symptoms of anxiety by imitating GABA's inhibitory effects. So it'll actually make it less, you'll have less anxiety as a result. Another technique is relaxation techniques and breathing retraining, and it tends to promote relaxation and help deal with the phobic anxiety. So, all right, there's a spider in front of you. I want you to count to 10 and breathe slowly. And that's pretty much what you're doing. So breathing retraining helps people to maintain correct breathing or correct abnormal breathing patterns when anticipating or exposed to a phobic stimulus. So it may also help to reduce anxiety or alleviate some of its symptoms. So essentially it's trying to get you to think and focus on your breathing rather than the phobic stimulus. Exercise is another way of getting you to relax. So it's helpful as a therapy because it promotes relaxation and thereby providing relief from anxiety. It helps you to focus on, exercise. It also helps to provide a distraction or time out from phobic stimuli, fear and anxiety. So you might actually, go for a run, right? And because you've got your heart rate going up and it's moving, you're more likely to have less of an experience of that stimuli, and we'll get to that in a sec. So coping with the stress and or associated physical reactions. So instead of focusing on how you're feeling about the anxiety, you're actually going for a run and having a different physical sensation. It also increases your tolerance to some of the fear and anxiety symptoms. Because you're having similar reactions physically, it does help you to cope a little better when you do experience them for the phobia stimulus. It does alter brain chemistry, so it releases endorphins and makes you feel better, and therefore you're less likely to be anxious when you come across the stimuli soon after. And some animal studies have found that exercise may activate GABA-releasing neurons more quickly. Another intervention, but this is from a psychological, the others have been more biological, would be cognitive behavior therapy. So a commonly used intervention involves the use of cognitive behavior therapy to change thoughts and behaviors that perpetuate the phobia and improve coping skills. So essentially, you're teaching people to change your thought patterns. Don't just dwell on the negative. And it goes through certain scenarios and it teaches you, all right, so we need to change the way you're thinking about this. The spider is not going to hurt you, right? Why do you know this? What does the spider do? And it encourages you to learn more about it. Therefore, you'll change your thought patterns. So it helps you to develop a new understanding of the feared stimuli, and reinforce the fact that it's not going to be dangerous and that you shouldn't avoid it and that safety behaviours are unnecessary and unhelpful. So it helps you to change your way of thinking and then changes your behaviours as well. This is another good one. This one comes up a lot in VCAR exams. It is called systematic desensitization, and it's a kind of behaviour where behavior therapy that aims to replace an anxiety response with a relaxation response when an individual with a specific phobia encounters a fear stimuli. So let's say, for example, I happen to be afraid of spiders, right? A psychologist would actually teach me relaxation techniques, and then I'd move up the hierarchy. I explain it in the next slide a little bit more detailed. So there's usually a 3-step process which involves the individual to learn to relax while gradually facing the increasingly anxiety-producing phobic stimuli. So as you approach it, so let's say we look at figure 13.20, and I do recommend you put this into your notes. You'll notice that look at pictures of a snake in books, so this is about 30. Up the top, hold snake in your hand is about 100. That's the most fear-inducing. This one's least. So you get to this point in the ladder and you would use those breathing techniques and those relaxation techniques, and you wouldn't move to the next step until you were completely relaxed when looking at pictures of snakes. Then you'd move to this step and you'd watch images of the live snakes on TV or the internet, and you'd use the breathing techniques again, right? And you wouldn't move on to the next step until you're completely relaxed doing that. So a fear hierarchy, and this is what this is called, also called anxiety hierarchy, is a list of feared objects or situations ranked from least to most anxiety producing. Working with a therapist, the individual identifies phobic stimuli and constructs a step ladder of anxiety producing objects and or situations, with the steps gradually increasing in difficulty. So this is a step-by-step process. Usually there's 3. I've just broken it down for you. So a psychologist in step 1 would teach the individual breathing and relaxation techniques to use when confronting the fear. So might teach me breathing techniques or monitoring my heart rate, and that's what would be step 1. In step 2, I'd create a fear hierarchy, which is a list of feared objects or situations ranked from least to most anxiety producing. So looking at a picture of a spider, and then that would be at the bottom. At the very top, it might be holding a spider in my hand. That's just crazy. But anyway, moving on. Step 3. The individual will experience the least anxiety-producing fear on the fear hierarchy and use the relaxation and breathing techniques to deal with this fear. Step 4. The individual will not move on to the next step of the fear hierarchy until they've completely relaxed and no longer show a fear reaction to that step of the fear hierarchy. So I won't move on to the next step of watching a video of a spider until I completely relaxed whilst looking at a picture of a spider. And then the individual will continue to move up the fear hierarchy until they've reached the top of the hierarchy of holding a spider. That is never going to happen. Alright, there's also social interventions. Social interventions, psychoeducation for families and supporters. Essentially what they're doing is they're not actually going into therapy, but rather what they're doing is teaching the family about the fear response, the phobia itself, why they fear it, and then trying to tell them better ways to actually cope with it and to cope with the individual. Don't laugh, don't throw away their fears, but actually support them. And you're also looking at not only support for the person, but also their family. And it is very important to have support. So it may include information about some or all of the following. So it could talk about the nature of the disorder and its diagnosis. So why does phobia exist? What is the role of the phobic stimuli? So what part does my fear of spiders have in my life? What having a specific phobia is like for the individual, both psychologically and physiologically. So what are the reactions? And your family learn more about it. The more they know, the more they can help you. How does it impact family and friends? The type of psychotherapies and treatments that are available. So you're teaching the family about what's available to the person. The role of importance of breathing retraining. So if you happen to, see a spider, getting your family not to kill the spider for you, but to actually tell you to breathe and to relax and, just working through it. The role and importance of support networks, so telling family you have to be there for them, you can't just walk away and, laugh it off. And you need to be aware there is stigma. So there are times where people are going to laugh and you need to be aware that this is not a good idea. Challenging unrealistic or anxious thoughts is another one. So I know for a fact that spiders are not going to be climbing in my ear in the middle of the night and laying eggs in my ear. However, this is an unrealistic thought that people actually have, right? And it's unhelpful. And because you're having that thought, right, it's going to trigger more anxious thoughts. Well, what happens if it is true? What happens if it goes into my brain and I start to die and all that sort of stuff, right? And because you're constantly thinking about this anxious thought, it gets worse and worse and worse. So what they encourage families to do is not say, all right, there's a spider in the bathtub, right? I'm just going to go kill it. It's actually saying, okay, tell me, why is that spider a danger to you? So it's not just saying, yeah, I'll kill it. It's actually going through the process of going, All right, tell me why. Why is it a danger to you? And that's pretty much what it is. All right, worked exam question. It is 6 marks. Okay, so psychiatrists in the Hopewell Flats area wanted to educate the public about issues related to mental health in order to help people identify when they should seek treatment. The psychiatrist prepared a pamphlet that included a number of the scenarios, such as the one below, and the one to the right. When Anne Breen was a young child, she developed a fear of the dark. She started using a nightlight as a child and continued to use one as an adult. So that's not good, I have highlighted it. When Anne Breen was 20 years old, she moved into a share house with her new housemates. Her housemates noticed that after a few months that Anne Breen always watched movies with the lights on and would not leave the share house in the evening, even to visit friends. One night the power was out in the share house while Anne Breen was at home alone. Several hours later, her housemates returned home from a party to find Anne Breen sitting on the couch in a highly distressed state. So we already know that it's affecting her everyday life. She's not able to watch movies in the light. She's not able to go outside, so it's impaired her daily functioning. Right? And it does cause distress. So in terms of reinforcement, why might Anne Breen still be using a nightlight? And this is 3 marks. So we know that we need to be talking about, in terms of reinforcement, we need to give at least 3 reasons. So 1 mark was awarded for each of the following. Naming a negative reinforcement as the relevant form of reinforcement, because you're removing an unpleasant stimulus. When they're talking about phobia, they're talking about negative reinforcement. Explaining how the use of the nightlight reduces the fear associated with an unpleasant stimulus, therefore negatively reinforcing it. And explaining how reduction of an unpleasant stimulus serves to make the behaviour more likely to persist in the future, because they're not actually facing it head on. Alright, so there was your 3 marks. Here's the second part to it. Is Anne Breen likely to be suffering from a phobia or an anxiety? Justify your response by comparing a phobia and anxiety in relation to Anne Breen. So here's a couple of things you need to note. It's asking you, first mark, is it anxiety or is it a phobia? So you have to say Anne Breen is suffering from, and pick one. You need to justify. When they say justify, you need to say, this is why it is a phobia. And this is why Anne Breen has this phobia. So you need to compare phobia and anxiety in relation to Anne Breen. So you need to say why it is a phobia and not an anxiety. So you get 1 mark here, 1 mark here, 1 mark here. So 1 mark for saying that Anne Breen is suffering from a phobia. It distresses her every day. It's a phobia. You get 2 marks for accurately defining a phobia relating to this example relevant to Anne Breen and contrasting it with anxiety. So you're saying a phobia is the irrational or excessive fear of a stimuli that interferes with daily functioning, whereas anxiety would just be a fear of impending doom or a physiological state. You need to be very, very clear. You're doing other things, but learning activities.